So, good day everyone. I'm Bethany Hernandez, first year college from BSN 1D. So now I'm going to demonstrate to you the assessment of lungs and the thorax of our patient. So first I need to introduce myself to my patient and verify his name. So, good day sir. I'm your student nurse for today. And may I ask what is your name? Date of birth? Ilang taon na po kayo?
19.
So, after the verification, now we need to prepare and assemble the equipment and the things that we will be needing. First is our stethoscope, skin marker or pen, and centimeter ruler. Now, we will explain to our client what we're going to do. So, good day sir. For now, I'm going to assess your lungs and thorax. And is that okay to you? Okay. So, next we need to do a hand hygiene. So, the rationale of this is for us to avoid the spreading of microorganisms or cross-contaminations among patients or clients. So next, we need to provide for client privacy. For example, close the curtains, or if we are in the examination room, close the door. And after that, we need to ask some few questions to our patient. So, sir, do you have a family history of cancer? Tuberculosis? Sir, do you take any medications? Do you have any allergies? Do you experience smoking? Or any problems in swelling, coughs, or wheezing? So, for this procedure to be more successful, we need to ask to our patient if he can take off his shirt. So, sir, can you please take off your shirt? So, now we will proceed in assessing first the posterior thorax of our patient. So, we will inspect for the shape and the symmetry of the thorax from its posterior and lateral view. So, sir, pwede po ba kayong tumalikod? Okay. So, side po. So, everything is normal in shape, with no visible or deformities. Also, there is no muscle retractions when breathing, and everything is symmetrical from the side to side of posterior and lateral view of our patient. So now we will assess for any lateral deviations of the spine of our patient. Also, we will observe from our patient if there are any rear. So, sir, pwede po ba kayong tumayo and mag-bend po? So, everything is normal with the spinal cord of our patient. It is straight and everything is same and no problems or abnormalities detected with the spinal cord of our patient. So, sir, pwede na po kayong umupo. Okay. So, now we will proceed in palpating the posterior thorax of our patient. So, sir, do you feel anything as I touch it? So, sir, can you please inhale, exhale slowly? So, everything in the posterior thorax of our patient is normal. There are no any bulges, any tenderness, or any abnormal movements, or any abnormal findings with the posterior thorax of our patient. So everything is normal and nothing to worry. So next, I'm going to proceed in palpating the posterior, for the posterior chest of our patient. So sir, pwede po ba kayong mag-inhale? So, there is full and, as I observed, there is full and symmetrical chest expansion when the client takes breath. And also, my thumb actually moved, meaning there were no abnormalities finding in the posterior chest of our patient. So next, we're going to palpate the chest for vocal tactile prematus of our patient. Okay, so sir, can you please say 1, 2, and 3 repeatedly, and don't stop until I didn't say you stop, okay? 1, 2, 3. 1, 2, 3. Okay, so okay na po sir. So the prematus of our patient is both symmetry, and it is easily identified in the intensity of the prematus. Also, there is a decrease in intensity of the prematus as I moved my hands a while ago as I palpate the tactile prematus of our patient. So now I'm going to percuss the thorax and the diaphragmic excursion of our patient. Okay, so as I percuss our patient, everything is normal, no abnormalities findings, and everything is normal, and the measurement is in 4 centimeter, which is normal. So now we're going to auscultate the chest of our patient using the diaphragm of our stethoscope. So sir, can you please take a deep breath? Okay, so as I auscultate our patient, everything is normal. No adventitious sounds detected with our patient such as wheezes or crackles. So everything in the auscultation is normal. So now after all the procedure in the posterior thorax, we will now proceed in the anterior thorax. So first, we need to inspect the breathing patterns of our patient and also inspect the costal angles and the angles at which the ribs enter the spine of our patient. So, sir, can you please So, sir, please inhale. Exhale. Okay, so everything is normal, quiet in the breathing of our patient, and it has an effortless respiration. And the costal angle is 90 degree, which is normal. Also, no abnormalities detected with our patient. Now we're going to palpate the anterior chest for the respiration excursion of our patient. So, sir, pwede po ba kayong humarap sa akin? Okay, so everything is normal as I palpate our patient, no pain detected on the client. Also, there is no tenderness as I palpate, and also there is no abnormal findings detected in my patient. So now we will proceed in palpating the tactile premitus in the same manner of the posterior chest of our patient. So now we will do it in the anterior chest of our patient. So sir, halap po kayo sa akin. So sir, pwede po bang sabihin niyo po yung 1, 2, 3 ulit? Okay, so there is no enlargement detected in the breast of our patient. Also, the premitus is symmetry, both left and the right, and it is easily identified in the upper region of the lungs of our patient. And also, there is no abnormalities detected in our patient. So now we're going to percuss the anterior chest of our patient. If anterior chest systematically of our patient. So, stay ready. So everything is normal and no abnormal findings detected in the anterior chest of our patient. As I percuss our patient, everything is normal and nothing to worry. And now we will proceed in auscultating the trachea and the anterior chest of our patient. So seriously. Okay, so there were no adventitious sound that is being heard, so that everything is normal in the anterior thorax of our patient. So after all the procedure, I need now to do the hand hygiene. And after the hand hygiene, I need to document all the data that I've gathered in our patient. So, that's how I demonstrate to you on how to assess the lungs and the thorax of our patient.